Okay, so in healthcare, a critical challenge is the inconsistent availability of blood products, specifically blood products that are used for transfusions, whether that's platelet transfusions, plasma transfusions, RBCs. Um, Most of these blood products are from donations, and due to lack of donations, there is an inconsistency in availability. So I have named my company Hematech Solutions. It is pioneering a shift from donation based to self sustaining blood processing. This will kind of revolutionize reliability and accessibility of these blood products. So this innovation expands the production of key blood products in vitro. So this would eliminate any kind of reliance on donors or blood donation. This transition ensures a consistent supply benefiting patients in need of urgent transfusions. So we're going to reshape the future of blood processing and transfusion for healthcare system, save lives, and enhance medical practices. So before I go over like market research, I really wanted to go over some big downfalls of medical research, and if it comes to then drug production, pharmaceutical production. So of course, a huge kind of hurdle, I'd hate to say hurdle, but in medical research and development is, unfortunately, there has to be a balance of a need and revenue production. So, of course, the primary mission of healthcare research or therapeutic enterprises is to enhance global healthcare with life-saving innovations. However, revenue is crucial for success, creating a challenge in balancing groundbreaking medical advances with financial viability. Of course, a good example of that is severe rare diseases. It is a substantial investment required for drug development and for therapeutics. And unfortunately, in a lot of rare diseases that may be cured or have a therapy for, they would not yield sufficient enough revenue due to limited demand. So a lot of kind of decisions are based in the balance of revenue and kind of healthcare global need. Of course, another downfall for drug production is the time and capital it takes. This company that I've created is not a drug company. It's more of a process sales, kind of selling a kit to process different blood products and expand them. And so it would be kind of self-generating revenue. You would consistently need to be purchasing kits. But when talking about a drug, which this very well could be if I wanted to sell blood products themselves that have been manipulated, it would then be a drug. And so that can take millions and millions of dollars and 10, 20 years of kind of research, regulatory processes, etc. So some market research that I've done, the global blood bank market, which is kind of what we would be moving away from. Maybe blood banks would start to process these blood products instead of just banking and receiving donated blood. But the blood banking market size is valued at about $13.85 billion in 2019 and expected to reach $21.8 billion by 2027. So it's a huge market. I wouldn't say it's very saturated. I mean, there's a lot of limited opportunity. I wouldn't say limited opportunity, but it's difficult to get in because it does take a lot of capital to kind of get into these healthcare markets. The global blood transfusion devices market was valued about $5.4 billion in 2022 and expected to hit around $9.6 billion in 2032. So also a huge market with a lot of growth and opportunity. I would say a big maybe hurdle might be a lot of blood banks are not for profit, so that means if you're really kind of trying to sell a revenue producing, hey, this is going to bring you lots of profits to a blood bank, that's not going to be as much of a selling point, especially if they're not for profit. I mean, of course they want to be revenue producing and they want to be able to sustain themselves, but a ton of money and coming in their pockets is not a priority. To go over the business model canvas, Hematech Solutions, so key partners would definitely be investors, stakeholders. That would be also a key resource. There's no way I could, with money that I could make, would be able to start this company. You would definitely need to find investors that are interested in biotech, see the science, understand that the science will work, and show your market size and, hey, this is the kind of money that we could make and this is how long it'll take us to get there. So key partners would definitely be investors and stakeholders, distributors, manufacturers, and third-party testers. So you could do your own manufacturing. If you have your GMP lab, your clean room, you have the structures and the facility to do so. Third-party testing, you always want to have some type of third-party testing whenever you're making some kind of GMP, good manufactured process, just to show non-biased, hey, this works, hey, it's sterile, things like that. So key activities would be in vitro blood product expansion. In here, I had written drug development, but after thinking a little bit more about the extensive time, money, and regulatory requirements that go behind that, you would rather sell a process. You'd rather sell this process that requires continual purchase of a kit or of buffers or of some type of component from you to where you keep revenue, but without having that huge burden of producing a drug, because that is like a red zone in biotech. It's like, okay, if you don't have to produce a drug, then you don't, because it's just so expensive and you have to have a ton of capital up front. Key resources, like I said, investors, and maybe research like hubs and programs. The University of Florida, I'm in Gainesville, Lake City, but I work in Gainesville. We have UF Innovate the Hub, Sid Martin, so a lot of these kind of business hubs that really support small businesses, especially in biotech, that you have an abundance of resources, like equipment, infrastructure. Value propositions, reduce the need for blood donations, of course. Customer relationships will be healthcare professionals, patients, regulatory authorities. Go down to cost structure, of course, COGS, your cost of goods sold, operational expenses, regulatory costs, IP, manufacturing, marketing, and revenue stream will be product and process sales, licensing, royalties, and hopefully a subscription-based revenue. I say hopefully, like I'm gonna really do this, but so in order to test my hypothesis, my plan is to meet with I have a national gene therapy director that I'm friends with. Meet with him to ensure like the regulatory path that I'm thinking for this product is a GMP process and not something else, because that heavily impacts cost. Meet with a biomedical engineer that I'm also friends with, and healthcare professionals to ensure scientific possibility of this product. Is this even possible? I am a scientist. My background's in biotech. Cell expansion theoretically should be possible. Just making sure it is. And doing a deep dive into market trends within the sector of this whole product process and how it can be implemented. So that's where I am. And we'll see where we get next week.